The immune system has important roles and functions in maintaining and improving the health of our body. The immune elements in our body are specialized to fight against elements that can adversely affect health, such as microorganisms or tumor cells, and to remove harmful agents from the body. However, research has shown that some of the diseases seen in the clinic develop because the immune system recognizes its own body cells as threats and attacks them. One of these diseases is lupus. Lupus, or systemic lupus erythematosus, is a rheumatic disease that affects many organs in the body. It is popularly known as butterfly disease because it is characterized by a butterfly-like red rash on the face. For you in this video, symptoms of lupus, types of butterfly disease, how to treat lupus, how to care for wounds in butterfly disease, what to watch out for, and what are the things to be aware of. We have covered important topics such as the causes of lupus. We therefore recommend that you watch the video to the end and take notes. Let's start if you are ready. Excessive exposure to ultraviolet rays, i.e. the sun, viruses, especially the Epstein-Barr virus encountered in children and adults, all kinds of chemicals, additives and medicines that we knowingly or unknowingly take into our bodies, can activate the immune system, also known as the immune system, and interact with the susceptible genes already present in the person, leading to lupus disease. The effects of exposure to these factors do not occur suddenly but develop over time. A chronic inflammatory process begins. If this inflammatory process is triggered by genetic predisposition, irreversible tissue damage can occur in the skin, joints, kidneys, all blood vessels, lungs, and many other tissues. The symptoms of lupus can vary, depending on which body system the problem affects. Note: lupus patients may have similar symptoms. In some people, the symptoms may appear suddenly, while in others they may progress slowly. In some, the disease is mild, while in others it is severe. Skin rashes are seen in this non-contagious disease. Especially a butterfly-like rash on the cheekbones is typical. Hair loss can be seen. There may also be swelling, redness, and limitation of movement in the joints. Susceptibility to infections, high fever, weight loss, and abdominal pain may develop. Kidney involvement is seen in 70% of patients, and it is very important not to overlook this issue if kidney involvement occurs. Kidney tests such as urea and creatinine may be elevated, and even dialysis may be needed. If central nervous system involvement occurs, the person may experience memory problems, hallucinations, seizures, and even coma. There are two clinical forms of butterfly disease. Diffuse lupus erythematosus, only the skin is affected. Lesions on the patient's skin may leave scars. Systemic lupus erythematosus, the organs are affected, as well as the skin. If left untreated, it can damage the patient's vital organs, causing permanent damage and risk to life. There is no definitive cure for lupus. Treatment is aimed at stopping the progression of the disease, preventing life-threatening complications, and relieving symptoms. Therefore, early diagnosis is of great importance because it is not possible to reverse advanced disease. Treatment of lupus is based on the symptoms and the organ systems involved, since each patient's condition may differ. It is necessary to inform the patient about the choice of treatment and its risks. Mostly antimalarial drugs and cortisone-containing drugs are used in treatment, but in some patients, non-steroidal anti-inflammatory drugs, immunosuppressants, that suppress the immune system in a controlled manner, and even some biological agents may be used. All these medications vary according to the symptoms, course, and severity of the disease. Patients should be advised to be careful in the sun during the treatment process. Doctor visits should be made as often as recommended and without interruption. Regular exercise, not smoking, and eating a healthy diet are also an important part of the treatment. Appropriate complementary therapies should be initiated in patients with vitamin D and calcium deficiency. Skin lesions are common in butterfly patients. Patients are highly sensitive to sunlight and redness. and blistering may develop on the skin exposed to sunlight, although the exact cause of butterfly disease is unknown. It is known that environmental factors such as sunlight, smoking, and stress play a triggering role. For this reason, people with butterfly disease should be protected from sunlight and go outside wearing appropriate clothing, sunscreen, and glasses. It is also very important to avoid smoking and minimize stress levels. If you have watched this video and enjoyed its content, please don't forget to like it. A like is of great importance to us and will help us provide more useful content in the future. Also, you can subscribe to follow our channel by subscribing. You can be instantly notified of new videos that will be posted on our channel and explore different topics to learn more on our channel. You can find videos on many different health topics through these videos. You can learn about various diseases and what to do for a healthy life. If you are interested in health topics, you can follow our channel to be informed about new videos and become a more health-conscious individual. You can also contribute to raising awareness about health issues by sharing our videos. Thank you.